Back, pick that up in a minute.
All right. So is this camera working?
It typically works, but I don't know what you unplugged.
It's not working now.
It worked. I mean, I use it all the time. I used it yesterday.
All right, cool. Video settings. Integrated web cam. There we go.
Oh.
Okay, so people should be able to join 5 minutes before it starts.
Get the camera working?
Yes.
Why didn't it work?
It was looking for a camera that wasn't there. See let me make sure that I'm not sharing my audio. Hang on. Good morning, everyone. I see there are 20 people in the room already, which is great. Good job being on time. We'll be starting in about 5 minutes. We're just going to give a few minutes to those folks who might be joining a little late. Okay, we've got 24 people in now. 25. 26. We have 31 people now in the room. We're just going to wait for a couple minutes for those who might join. All right. We have panelists and we have attendees. We have a total of 40 people are on now, and it's just about 12 noon. So we'll wait for another minute or so in case anybody joins right at noon. But you have passed the test. You've joined the meeting on time. You probably were waiting in a lobby for the last 15 minutes because you weren't allowed to join the webinar until about 5 minutes ago. All right, it's 12 noon, and we might have some people join after, but we've got 46 attendees right now and a couple of panelists. My name is Ram Upadhyay, and I am the Nursing Resource Liaison for the North Carolina Department of Public Safety. I want to thank you for joining today's webinar on providing healthcare to a vulnerable population. And I wanted to just let you know that this meeting is being recorded. This webinar is being recorded. So let's get right to it. So I'm going to go ahead and share my screen now. So today we're having a webinar. You're going to get 1 hour of continuing nurse education for this webinar, providing healthcare to a vulnerable population. Once again, my name is Ram Upadhyay. I'm Nursing Resource Liaison, and this webinar was is provided to you in part by the North Carolina Department of Public Safety, and helping me write this webinar was Alyssa Brody, Nursing Education Director. So I have this disclosure that I have to read in order for you to get continuing nurse education or nurse continuing personal development. Participants must attend 90% of this CNE activity and participate in the self-assessment before and after the program to receive their CNE. All learners will have the opportunity to ask questions of the DPS panel. Further evaluation and comments can be by email, SurveyMonkey, and a discussion at the end of the program. Neither the speakers nor the members of the planning committee have any conflicts of interest related to the content of this activity. North Carolina Department of Public Safety, Division of Prisons, Health and Wellness is approved as a provider of nursing continuing professional development by the North Carolina Nurses Association and an accredited provider by the American Nurses Credentialing Center's Commission on Accreditation. So we have these learning outcomes. By the end of this session, you should be able to define what is a vulnerable population. You'll be able to describe healthcare delivery in a non-traditional setting and list 2 to 3 different areas of practice. So this is a self-assessment. You'll be doing this at the end of the presentation as well, and hopefully your score will go up. So you're going to just score yourself in this self-assessment on the levels of 1 to 4. 1, that you don't know at all about that. 2, a little. 3, pretty good. And 4, really well. So I know what a vulnerable population is. 1 through 4, you're going to assign yourself a number. You can write it down if you like. I know different healthcare delivery systems in non-traditional settings. 1 through 4. I know 2 or more opportunities in correctional healthcare. 1 through 4. And I know the role of nursing within corrections. So just popped up on this chat, which is new for me. It must be an update for WebEx. Someone said, how do I get this form? Well, you can get this form on SurveyMonkey. There's a link there and also a QR code. And I can make this presentation available to you after the presentation if you email me. Monitoring the chat will be my co-host, Valerie Langley, and also as panelists, we have Dabney Weems and Letitia Owen. They'll be monitoring the chat in case I miss anybody. So what is a vulnerable population? I'm going to ask you to answer this question. And you don't see a link or a QR code. Okay. So just send me an email at the end of the presentation, and I'll make sure that you get a link to the self-evaluation. So answer in the chat what you believe a vulnerable population is. What do you think a vulnerable population, what does it mean to you? Good. Patients might be coerced to do something. Underlying medical issues not treated. Economically disadvantaged. Very true. High risk. The elderly, group of people who are at risk for adverse. A lot of answers coming in. Correct. These are all correct. Immigrants. Someone who may be uninsured or underinsured. Dependent on someone. These are all correct answers. Very good. So a vulnerable population includes those who have no current health care, employment, or shelter. They may have undiagnosed problems such as cancer, diabetes, and PTSD. And they may have uncontrolled chronic conditions. So who cares for these people? Who cares for the vulnerable? And and you answered this question already. Where does one find the vulnerable? Homeless, long-term care facilities, jails, prisons, other marginalized populations. And who cares for these people? Often it is a public health nurse. Public health nurses can be found in a variety of settings. So what is public health nursing? Well, according to the Missouri Department of Health and Human Services in 2021, they defined public health nursing as the health and healthcare needs of a population are assessed. See if any of these words sound familiar to you. A plan for intervention is developed. That plan is implemented. Evaluations are conducted, and the results are used to direct the delivery of care. So public health nursing then is the practice of promoting and protecting health of populations using the knowledge from nursing. Public health nursing is also a systematic process based upon the community's strengths, needs, and expectations, current scientific knowledge, available resources, accepted criteria and standards of nursing practice, the agency purpose, philosophy, and objectives, and the participation, cooperation, and understanding of the population. One of the most vulnerable and underserved populations are those that are incarcerated persons and live within our prisons. In correctional healthcare providers work with vulnerable populations every day. And nursing's mission coincides with the mission of correctional healthcare. A couple of things that you might not be aware of this vulnerable population that is also underserved within the prison system is that up to 40% have a chronic disease. Greater than half of them also have a diagnosed mental illness, and this is significantly higher than the larger community. So who works in correctional healthcare? Unlike other healthcare providers in North Carolina, correctional healthcare offers an expansive network of healthcare facilities across the state to serve the needs of a very vulnerable population. Due to life circumstances, many of our patients enter our care needing treatment for pre-existing conditions. The diversity of our provider network allows our teams to diagnose and treat these conditions and elevate the overall health and well-being of our communities. There's a variety of roles available in corrections. Of course, there is the professional nurse, but you could be working in a specialty clinic. These community health nurses work as float nurses, outreach nurses, chronic disease specialists. They could work in behavioral health, nursing informatics, telehealth, risk management, utilization review, education, recruiting, infection prevention are just a few areas where someone would work in corrections as a public health nurse. Healthcare in the correctional environment is just like everywhere else. It requires similar practices to private sector employees, but the mission is the same. Patient care, advocacy, education are the primary goals we serve. Again, due to the life circumstances that brought many of patients to our facilities, they may not have a history of caring for their own needs properly. Therefore, educating them about the importance of good health and nutrition is a critical part of the overall service that must be provided to vulnerable populations. Generally speaking, the choice to work in healthcare places us in contact with all kinds of work conditions that can be dangerous. Being exposed to sickness and disease is no different when you're working with a vulnerable population. But we're going to talk about what kind of security is offered in correctional healthcare that is beyond the level of security that you work with in many hospitals. Healthcare settings within corrections, believe it or not, has urgent care, emergency services. There are many inpatient medical and behavioral health beds, and there's even surgery provided within the prisons and sterile surgical operating suites. The goal for correctional healthcare is to provide care consistent with the community standards, and often this care exceeds the standards even in the community. What kind of services are offered within correctional facilities? Well, there's provider clinics, specialty clinics, chronic disease clinics. Preventive care is a big part of correctional healthcare as part of being a public health nurse. There's X-rays, CAT scans, MRIs, even long-term care, assisted living, hospice, palliative care, and telemedicine. So correctional healthcare serves the vulnerable population within your community. What are some attributes of nurses that serve vulnerable populations or public health nurses? If you were to come up with the ideal public health nurse, what kind of characteristics do you think that you would assign that individual? And enter in the chat your response. Resourceful, yeah. Caring, Tina said caring. Angela says compassionate. So did Julie. Erlene says non-biased, patient, good listener, generalist, multilingual, that's true. Someone who cares, a teacher. These are all correct answers. Unflappable, I like that. Experienced, absolutely. So some of the attributes of nurses that serve in vulnerable populations, they remain calm under pressure. That sounds like unflappable to me. Detail-oriented, strong assessment skills. They address problems before they arise. They use crisis intervention skills. They are fair, firm, and consistent. They're compassionate. They're skilled communicators. They're respectful, accountable, critical thinkers, and like the Boy Scouts, they're always prepared. There are some advantages for nursing that work in corrections. First of all, it's a nurse-driven environment. Because of our mission, a nurse-driven atmosphere means that the healthcare we provide is administered in an environment that is set by nurses. You know that if you're a patient in the hospital, you have to be admitted by a physician. A physician's order is required to be admitted to a hospital, either a physician or an advanced practice registered nurse. But in the care of those folks who are incarcerated, these nurses set the goals and interventions necessary for our patients to achieve optimal health. Nurses get to do what they were trained to do. Nurses use the skill sets that they were trained for and provide the care necessary. They use their skill to the utmost and to the fullest extent of their training. Why? Because the next bullet point tells us why. There's a great deal of autonomy in corrections. Throughout the correctional system in North Carolina and throughout the United States, nurses are called upon to treat patients and provide interventions exclusive sometimes of a provider. We have a set of protocols that have standing orders that allow nurses to provide treatment for patients, whether it's a urgent, semi-urgent, or emergent matter. Nurses get to work in a variety of healthcare areas. There's locations all across North Carolina. Nurses can work flexible schedules. Our patient census does not dictate who works and who is called off. Many of you before COVID may remember when census was low and you got all dressed and ready for work and you went into the hospital and the charge nurse met you at the nurse's station and with a clipboard in their hands and said, well, it's your turn. Our census is low and we need to decrease staffing, so you get to go home. And normally I think that would be a great thing, except that you've already got yourself all dressed and ready and you weren't prepared to do anything else today but work. And now you've got to go home and either take a vacation day or take an unpaid day. And that never happens in correctional nursing, at least not for the state of North Carolina. It's also it's never the same day twice. There are some fantastic things that you get to see in correctional healthcare that I've never seen outside of a textbook. Delivering the best care. We pride ourselves on communication and transparency with daily shift reports, monthly department meetings, continuous quality improvement that involves in the entire state with other disciplines, including pharmacy and dietary and everyone that's involved in caring for the patient. We also have partnerships with the community and telehealth to provide specialized health care. There are 50 or more nursing protocols that I mentioned before for handling a variety of situations. And of course, we always have a physician on call, but many times the physician will operate provider clinics. And again, being a nurse-driven environment, we set the schedule for the provider to see patients when they're needed to be seen by either a physician or advanced practice provider. Just like in the hospital, discharge planning begins on the day of admission, and we outline various patient needs, whether it be medical, psychological, emotional, family support, community support, financial, employment, and educational. 90 days before the release date, there's a referral made to the social worker, which there is one at every facility, to outline any additional needs in the community that the incarcerated person might have before they're discharged from prison. Here's just an example of a few people that started working with us as a registered nurse, a registered professional nurse, and then worked their way up through the ranks to become part of nursing leadership within the prison system. And this is what they had to say about what they like about the specialty of working in correctional nursing, the specialty of correctional nursing. I like the autonomy of providing patient care. While your work will always be performed in consultation with a physician, it's unlikely the doctor will be on the facility grounds every day advising you what to do in every scenario. Your patients are going to be relying upon you to help them then and there. This is a terrific opportunity to use your nursing license to its fullest extent and the fullest of your training. Every day I learn something new. Correctional nursing expands your skill set from drawing labs to head-to-toe assessments, urgent care, chronic disease, diabetic care, EKGs, and assessment skill will grow in all areas. And I can tell you from experience that correctional nursing, public health nursing, and caring for vulnerable populations is nothing like you see on TV or in the movies. There's definitely a balance of care with humanity. Currently, there's nearly 3 million men and women that are incarcerated in America's jails and prisons. Of these 3 million inmates, it's estimated that 40% or more are managing chronic medical conditions. Many of these have mental illness and are being treated for substance abuse and addiction. There's definitely opportunities within corrections to grow as a nurse. Because we're self-insured, we have our own utilization review team made up of by nurses. There's a great deal of training, and your continuing education is provided free of charge. So the continuing education that is required by the state of North Carolina would be provided to you free of charge. There's a patient liaison, which is kind of a go-between for families who want to check on their loved ones day to day. And a kind of tongue-in-cheek, remember when I was working as a nurse in the hospital, I became a nurse for many of the same reasons that you did, but chiefly I cared about people. I wanted to care for people, and of course, families are very important. But I found that this was often a distractor when I was caring for patients, when different family members came in that weren't communicating with each other and wanted to know how their loved one was. In our environment, uh, patients' families are not allowed in the medical unit. We have specialized visitation areas, and we have a family liaison that works full time answering questions of families. We have a set of nursing protocols, like I mentioned, that provide guidance in a variety of areas. Of course, nursing judgment has to be used to determine and triage what protocols will be used in what situation. We have mentorship. In this specialty of correctional nursing, it takes at least a year in some cases to become comfortable working with, and in this population, working with triage and doing medication administration a different way, doing patient teaching a different way. And that time will be taken between you and a mentor if you ever decide to work in correctional nursing. There's many subspecialties available. It's very similar to working in a doctor's office. I would say it's like working in a doctor's office with the doctor being there just once or twice a week. There is a great deal of orientation, like I said, and mentorship to this highly specialized area. And like I said, nursing in a correctional facility is just like nursing anywhere else. Our priorities are to take care of patients, to prioritize care, to advocate for the patient, to provide patient education. In fact, the question I get asked the most about nurses who want to know about what it's like to work in corrections is it safe? And the truth is, it's actually safer to work as a nurse in the prison system than it is to work in your local emergency department. Do you believe that? Well, let me give you a scenario. So in the emergency department, you really don't know what your patient has when they come in. They could be high, they could attack you with a weapon, and your only recourse is to call the hospital security, which they may or may not have the training that's required. They may be 18 years old of age, they could be 65 years of age. But in the prison environment, by policy, no matter what you do with the patient, whether it is patient education, medication administration, teaching, assessment, you always have to have a correctional officer with you, and that's by policy. And this is not just the security guard, this is a trained officer that has the tools and training to keep you and everyone else in there safe. Our correctional sites are approved as clinical training sites, and we've been training physicians for years here. We also now have several schools of nursing within North Carolina that use us as a clinical training site. We have a world-renowned PhD psychology intern program, and we have affiliations with almost 60, possibly more than 60 schools across the country for providing training for nurse practitioners. Nursing has been on the forefront of care in the state of North Carolina, and there's been new developments in the prison system that have been driven by nursing. Therapeutic diversion units divert those who would otherwise end up in restrictive housing, sending them to a unit where they can learn how to reintegrate into the general population. These are for persistent mental the persistent mentally ill that would otherwise end up in what we know as solitary confinement, but is now called restrictive housing, which isn't going to make them better. And as a tool, it doesn't work very well for the persistently mentally ill to modify behavior. So we've set up therapeutic diversion units for these folks and rehabilitation diversion units. We have crisis intervention teams. We have HOPE training. And HOPE training is kind of a mental health first aid. HOPE stands for heightened awareness, observe and listen, provide support and reassurance, encourage compliance with treatment, and self-help strategies. We now have a long-term care facility. We just finished construction, which is part of our hospital, our Central Prison Healthcare Complex. For lack of a better term, we call it Unit 7. And a section of that long-term care facility is devoted to end-of-life care and hospice. And every offender within the prison system works unless they have a medical reason that they can't. And some of them can apply to a specialized position that they'll be trained for called the Inmate Care Assistant Program, where they can actually provide care, activities of daily living to those who are on end-of-life care, palliative care, and in hospice. Like I said before, there are several services provided to promote the health and wellness of this very vulnerable and underserved population. We have physical therapy, lab, x-rays, mammograms, dentistry, dietary, dialysis, pharmacy, and surgery. 36 of our 55 facilities across the state have a dental clinic that is staffed by a dentist and dental techs and dental hygienists. And this brings me to a part of correctional healthcare, correctional nursing that is really makes it an honor to serve this population. Many times these men and women come from a very low socioeconomic status. And when they come to us and are admitted to prison, they may not have had a single healthcare encounter because it wasn't high on their priority. They may not have had a single healthcare encounter in 5, 10, 15, 20 years or more. And when they come to us, we do a battery of tests and assessments. And often we find that they have chronic diseases that they didn't even know they had. And we're in the unique position to provide the initial care, treatment, and education to these folks that come to us for medical care. And in that way, we get to do what I think no other specialty gets to on a daily basis. And that's why it's such an honor to serve this often marginalized population. Did you know how, by the way, that there are almost 55, there's between 53 and 55 prisons in North Carolina, and every one of them has nurses. There's over 1,000 nurses that work in the state prison system, and we serve over 30,000 offenders of every age in all walks of life. We have lots of support positions, such as regional nurse supervisors, regional directors of nursing, regional educators. In fact, there is probably a state prison or a state correctional facility somewhere nearby where you are. We don't advertise heavily, so there's no billboards that say that, there's a prison over here. They're usually hidden by trees, especially in Raleigh, where they're known as the City of Oaks. We surround our facilities with trees. But if you came to work for the state correctional system, there's many opportunities for growth. We really do like to grow our own. And here's just a few examples. Our chief nursing officer, Valerie Langley, started out as a temporary nurse back in the 90s, and she became a staff nurse shortly thereafter, and then lead nurse, nursing supervisor, and she became the Eastern Regional Director of Nursing. Then she moved into a position as clinical informatics director before she was promoted just a couple of years ago to chief nursing officer. Letitia Owen, likewise, our nursing services operations manager, started out as a travel nurse in Scotland and moved into a staff nurse and lead nurse, and then nursing supervisor position before she was promoted to nursing services operations manager. Letitia Owen is a real cheerleader and has a can-do attitude. She likes to say that she's all in. Beverly Stubbs says, together we can dream, believe, lead, and achieve. And she started out as a state staff nurse as well before she worked up her way to nurse supervisor, just like Ms. Owen, and then became a nurse consultant for the South Central Regional Office. Here's a few resources and organizations that are devoted to the specialty of correctional nursing. If you'd like to know more, these agencies can tell you more. The American Correctional Nurses Association, the American Correctional Association, which includes custody officers and healthcare, the National Commission on Correctional Healthcare, the Academy of Correctional Health Professionals, the American College of Correctional Physicians, the Academic Consortium on Criminal Justice Health, and the International Association of Forensic Nurses. So we've now come to the end of the webinar, and I'd like to know if you have learned anything from today's presentation. So just do that same self-assessment to determine if you know more about what a vulnerable population is, different healthcare delivery systems in non-traditional settings, 2 or more opportunities in correctional healthcare, and the role of nursing within corrections. So if you've achieved a higher score than when you first started this webinar, go ahead and share your score in the comments and mention if your score increased. These are references that helped design this webinar to share with you today for your 1 hour of continuing education. And now we have time for some questions and answers. And we have a panel of correctional nurses here today. We have Valerie Langley, the Chief Nursing Officer. We have Letitia Owen, the Nursing Services Operations Manager, and myself, the Nursing Resource Liaison. And I also, before I go to question and answers, I would be remiss if I didn't mention that that if you're interested in a tour, I'd like to invite you on a tour of our 2 main healthcare facilities, if you will, in Raleigh. Central Prison Healthcare Complex will be offering tours on June 14th and 15th, and you can contact me for more information. And then the women's facility, which is known as NCCIW, or the North Carolina Correctional Institute for Women, will be offering tours on June 21st and 22nd. If you'd like to see what it's like inside, if you've never been inside a prison before, I think you'll be quite surprised by what you find. So now I'd like to open it up for questions from the audience to see if you have any specific questions for our panelists today. So let's see, I'm going to open up the chat now. And chat, oh, we have 2 options. We actually have chat and Q&A. So let's see if there's anything in the Q&A.
So there's a question about somebody who's previously worked for us at NCCIW and is interested in working some weekends. So Ms. Owen, could you put Ram's email in the chat?
Yeah.
And Ms. Joyner could reach out to Ram to discuss that further.
That's a real That's gonna be a real test for Miss Owen. See how many times she spelled my name.
I'm gonna cheat, Rom.
So are you gonna defer that to me?
No, I'm gonna do it.
Great.
So while folks are thinking about some questions they may want to ask, I would just like to share with everybody, when providing care to this population, as Ram said, a lot of times our patients um, are coming in and they really have not accessed the healthcare system or consistently accessed the healthcare system prior to coming into the prison system. And when you think about, a lot of people say, well, we didn't know there was nurses in prison, and what do you do? Everything we do really mirrors what happens in the community. So for instance, when patients are coming in from the county jails who've been sentenced, and they're arriving in, think of it like arriving at your doctor's office for the very first time. We bring our patients in, we do heights and weights and vital signs, we draw their blood, we do medical histories. A lot of times from the second they walk in the door, we begin identifying healthcare problems that currently exist that these offenders didn't even know they had. For instance, we can identify the likelihood of diabetes upon arrival. And begin providing treatment for these offenders. A lot of times they have symptoms, but they really just don't know what they are, or they just learn to live with them and don't realize that they actually have an underlying health condition brewing under the surface. So, when it comes to serving this population, it can be very rewarding when we are evaluating them and our physicians are diagnosing them with these healthcare problems for the very first time. It's a really great opportunity to provide education to these offenders. We're often getting unstable chronic diseases under control. And then when we're ready to return them to the community, we're returning them to the community much better than what we found them. And that's usually what our goal is to improve their health condition while they're spending time with us. And then when they return to the community, they're much more educated, they're treated, and we link them to services externally whenever they're going home.
So we've got a couple of questions about employment in the chat. Any opportunities to coordinate preventive services for women, such as yearly mammograms and pap smear procedures? That is a definite yes.
Yes.
What types of shifts do you offer? Is there a link I can use to find out retirement benefits, pay, etc.? Yes. Email me for more information on that. I work in the, Tina says I work in the endoscopy department at the hospital. Do you have such in the prison? As a matter of fact, we do.
Let's pause and talk about that for a second, Rom.
Yep.
One of the things that probably most people in the community don't realize is that we actually have an operating room at our Central Prison Healthcare Complex. So that operating room has an endo suite, and we do endoscopies, and we actually have a team from UNC that comes in to perform the procedures. And we bring in offenders from across the state for those particular clinics. We also do some ENT procedures in that clinic, and some minor surgical procedures. So most people don't realize we have those services inside the prison system, but we certainly do. And there was also a question about mammograms and pap smears. We actually do mammograms on site at our women's facility, and we also do pap smears as part of our routine annual screening for our patients, just like what would occur in the community. Oh, and you're muted.
Sorry.
That's all right. What options are available for an advanced practice registered nurse with experience as an RN first assistant in surgery. So, wow, that's that's fantastic qualification. As a first assistant, you do a lot in
So,
surgery.
so I can share with you, we do have some folks who work over at Central Prison. I would love to invite you to come for a tour to see our operating room. But
Yes.
there are multiple positions in our OR. We have a supervisor position, and then we have advanced practice nurses in our operating suite, as well as some support staff over there. So we would love an opportunity to show it off to anybody who's interested in seeing it. And the staff there could certainly share more about what specifically they do in their daily operation. But our OR really runs, it's kind of based on the UNC provider schedule, but we have several specialties that come in and use our space to see our patients. We do have a variety of staff that are employed with us. We have agency nurses who work 13-week contracts with us. We have some temp solutions staff. Those are often part-time, but can work up to 40 hours a week. And we employ them through temp solutions. It's an 11 month contract, usually with an option to renew. So the remainder of our staff are state employees, and we have through Temp Solutions and state employees, we have over 1,000 nursing positions in our system.
We really are proud of what we do here, if you can't tell already. And we'd love to showcase both of those facilities because it's something that you can be really proud of in North Carolina, because North Carolina has the only state-run hospital specifically dedicated to the inmate population right here in Raleigh, with over 120 inpatient medical surgical beds, over 200 inpatient mental health beds, and like Valerie mentioned, the OR with surgery and an ER and many other things. So to remind you of the dates of the tours, and you can contact me for more information, June 14th and 15th at Central Prison Healthcare Complex, and June 21st and 22nd at NCCIW. But I'd like to take an opportunity, since a couple of people asked about employment with the North Carolina Department of Public Safety. Let me take this opportunity right now to just to share something with you. So you don't have to take my word for it. You can actually listen to what staff nurses have to say about DPS.
Nursing feels really good. Working in corrections is challenging.
There's no sound coming through, Rom.
Oh, no sound?
No.
No sound, is that right?
Let's put the link to the video in the chat, and
Certainly.
folks who are interested
Yeah.
can certainly hop on and take a look, and yeah.
Get our job done. But it's the people that I work with always have been so. So what you're looking to do is more corrections have it. It's a job just like any other job, and it has its challenges. The people that
Does anybody else have any questions about patient care provided within the prison system?
It looks like we have some questions that someone's been trying to send some questions to Rom.
Yeah.
In the question and answers. We have another question, wants to know how they can go about getting a tour.
Okay, let's see, Q&A. I had that a minute ago. Where did it go?
So I put your email address in the Q&A, Rom.
Okay, fantastic, good. And I put the link to that to where you can see that video, because there's a way to allow the WebEx to to do the system audio.
I put that link in the question and answer too.
Fantastic.
So it looks like we have a lot of interest as far as, you know, part-time work and things like that. We did share Rom's email address. We'd be happy to, if you want to email him. We did have another person that said that they had submitted their resume, but never heard anything. So if you could also email Rom and we can see what we can find out about that. We can
Where did it go?
certainly-
Yeah.
We can certainly look into that for you.
So I closed the Q&A and I can't find it again. Is there any more? I see
Rom, you're
the
muted.
chat, but is can you hear me now?
Yes.
I see the chat, but I closed the Q&A and I can't find it. I can't find it. So is there anything in the Q&A that we haven't addressed?
So that's where I found the wanting the information about tours.
Great.
So if you can repeat those dates and tell them how they go about coming to that.
Absolutely. So we'll be hosting tours on June 14th and 15th. I believe it'll be starting in the morning and going pretty much all day. June 14th and 15th at the Central Prison Healthcare Complex, and June 21st and 22nd at the North Carolina Correctional Institute for Women.
What was the women's date? June?
21st and 22nd. And we've had some people that had to drop off, and that's fine because they'll still get continuing education because they attended the presentation. But we still have 100 participants still on the call on the webinar. At one point we had over 120. So it's been a great turnout today. And again, I'd like to thank the panelists. Valerie Langley, Chief Nursing Officer, and Letitia Owen, the Nursing Services Operations Manager for the Department of Public Safety.
So Ron, we have another question in the question and answers, if we can
Great.
address that.
Sure.
So Jennifer asked if there are an OR and an ER available at Central Prison. Why are they done at other hospitals as well?
Oh, that's a good question.
Yeah, so that's an excellent question. So, you know, we have an OR and we have an emergency room, but of course there are some things that we don't have absolutely everything available that a regular hospital does. So sometimes if they're, if an injury or a sickness needs, some more specialized care than what we offer, then that's why we have to send the offenders to other local hospitals. Also, our central prison is in Raleigh. So, we have 55 facilities spread out across the state. So those 55 facilities, some of them are a long ways from Central Prison. So, then they have to be treated in the local facilities because that would be too long a trip for them to get there.
That's right. And if you've been a nurse for a while, you probably have taken care of a patient that was also an inmate in a prison. And maybe your only exposure to that was the prisoner that you were taking care of in the hospital. And I can tell you that it is very, very different when you have an offender that you're caring for in the prison versus one that you're taking care of in the hospital. First of all, in the hospital, because for safety, they'll have to be handcuffed, and there has to be one or two correctional officers in the room with you whose agenda is to keep you and everybody else in there safe. But if you see what we do within our walls, I think you'll see that it's quite different than anything that you've experienced outside the prison facility, outside the hospital.
We have a question as well. I don't know if we answered it yet. That asked if it was more bedside nursing or clinical nursing. Did we answer that?
We didn't really know. You wear a lot of hats, and I think Miss Owen can answer that question better than me. but you wear a lot of hats as a correctional nurse. So tell them, if you can, it's a lot, but see if you can tell them a little bit about what it's like to be a correctional nurse.
Yes. So, being a correctional nurse, I've done it for about 12 years now. Absolutely love it. Can't imagine going back to the hospital. It's definitely my calling. It seems to be people either love it or hate it. So, everybody has their specialty in nursing that they choose and that they fall in love with. Correctional nursing happened to be mine. So, in the question of is it more bedside nursing or clinical nursing, a lot of that depends on where you choose to work. So at Central Prison in the hospital setting, of course, it's more bedside nursing. But in many of our outpatient facilities, then it's more similar to the best way I could compare it to is in urgent care. So it's kind of like an urgent care. And the fact that, one day you might have offenders that are just complaining of cold-like symptoms or, something minor. They might have some allergies or they might be constipated. But then you also have some emergencies that come up. So, we have a wide variety of ages. Our offenders are anywhere from 17 to 75, 80. So, there's a variety of needs that they have. So a lot of the outpatient facilities, it's kind of like an urgent care. We have scheduled clinics where the doctors are usually hold clinics depending on the size of the facility, anywhere from 1 to 5 days a week. Same way with nursing, what we call nurse sick call. So a nurse sick call is basically where the offender puts his complaint on paper, and then we schedule him for an appointment to see the nurse, and that's where the protocols come in that Ram referred to earlier. So we have a lot of protocols, and we treat a lot of things with just over-the-counter type medications or processes. Maybe they're having trouble with vision. We have optometrists that are on site, not necessarily on site, but within the system that they can go to. So, if they're complaining of a toothache, then we have dentists that are available. So we have a lot of more than you can imagine that is available right there within the prison system. It's kind of like a city within a city. It's not any different really than any other type of public health nursing. It's just that the offenders live there, right? So, it's considered their home. And, even though it might not be ideally where they want to live, that is where they live at the time. So it's, we have a variety of things. We do a lot of preventative health care. We do a lot of emergent treatments when we need it. And like we said, sometimes they have to be sent to the emergency room or an outside entity if we don't have that available at the particular facility you're at. But like we said, there's 55 facilities across the state. We have a wide range of acuities. And most of your outpatient facilities, the offenders are all walkie-talkies, as we call them. They do provide their own care. They are able to provide all their own ADLs. So we don't really have to do any of those things. So in that case, it's a clinic nursing type experience. I hope that answers the question.
I think so. And just like a follow-up on that question, someone asked that is the correctional, is healthcare corrections a 24/7 operation? And that also varies from facility to facility. Most of the large facilities operate 24 hours a day, 7 days a week, and have all 3 shifts. Some of the smaller facilities, like the one up in Forsyth County, has just one nurse there, and it's a very small facility with only about 200 offenders there, and it operates from 9 to 5 Monday through Friday.
So I'd like to add something to that, Ram, if you don't mind.
Sure.
So when you talk about the small facilities and having 200 patients, I certainly don't want anyone to think that you are providing care for 200 patients with one nurse, because that is not the case at all. You're basically, the offenders at places that have one nurse are usually, don't have any serious health problems. They don't get any medications that have to be given by the nurse. We have what we call KOP medications and DOT medications. The KOP medications are what we call keep on person. And those medications are issued to the offenders 30 days at a time, just in a prescription bottle, just like you or I would go to Walgreens and pick up. So the DOT meds, there's just a few of those in the wide array of medications where they actually have to report to the nurse to get those meds, and we make sure that they take those every day. The one nurse camps don't usually have any of those type of things. So even though, there's 200 offenders there, it's not like providing nursing care for 200 patients at one time.
So hemodialysis services and maternity. So good question. We do have maternity services over at our women's prisons. We actually have an OBGYN that comes in from UNC, and she sees our maternity patients and follows them. And our patients go out to deliver babies. We also provide support to the county jail system statewide for pregnant female offenders. So as those females get close to their due date, they actually are transferred in to our women's facility for additional care until it's time for them to have their baby. So we do have maternity services, and they're actually, the majority of those are on site at women's prison. So hemodialysis, we actually have 2 sites within the state that provide hemodialysis. One is the Central Prison Healthcare Complex, and the other one is Scotland Correctional. And those 2 facilities have a number of dialysis chairs. They have clinic services that a clinic comes in and provides support and care for dialysis. And all of them, each clinic runs dialysis 7 days a week. So those services are there for our patients. And the way our structure is, as kind of Ram and Ms. Owen alluded to, was that we do have an acuity system in place, and each facility has a certain type of acuity patient that they accept. So Forsyth, the small 200 man camp, would house acuity 1 offenders who really don't need much from nursing. They take their own medications, and they really just need supportive services. We have acuity level 2 patients. Those are patients who are on direct observation therapy, where they take their medications from the nurse, may have more complex healthcare problems, and may need additional nursing support. Then we have acuity level 3, which is unstable chronic disease. Those patients need more support from nursing and providers. And then we have our infirmary level care. And we do have a few of those throughout the facility, in addition to our inpatient units at CP and NCCIW.
Okay. So let's see, if you're employed with corrections, do you typically travel to other correctional facilities, or will you be at the location you applied to? Anyone want to answer that question?
I can respond to that.
Okay.
Typically, when you apply and you're hired at a particular facility, that's where you report to every day to provide healthcare services. However, in our agency, patients and operations ebb and flow. So for instance, if a population is down at a particular facility, we may ask some of the nursing staff to go support another nearby facility. So that does occur. We actually have volunteers who like to work at a variety of facilities. So we may have a nurse at Wake Correctional who would like to work extra hours, and they may go over to Central Prison Healthcare Complex and provide some additional services over there. So we do share staff. We're all one team, one mission. So we do share staff amongst the facilities when there is a need, or if there's a census issue where census is down or acuity is up, we may share staff amongst facilities to provide and maintain healthcare.
We have another question that asks, which level of custody has the greatest nursing need now?
Again, that ebbs and flows. It just depends on the particular facility, the population of the maximum population, the size of the facility. and the number of nursing staff as well as their medical mission. So it's constantly evolving.
Another question here is, do prior military do better with that environment? I would say so. It's a very structured environment.
Yep.
We use some of the same terms like sergeant, lieutenant, captain, and I'd say a high number, especially close to the military bases, like down at Fort or Camp Lejeune in Jacksonville or Fort Bragg. A high number of the folks that work there in those facilities are prior military.
And Ron, we have a question that wants to know how they get credit for this presentation. Would you like to tell them how that works?
Yep, certainly. So I am going to send a certificate of attendance with your credit, your one CNE on there, and you'll just need to put your name on the certificate, and that will be your evidence of continuing nursing education for the Board of Nursing. If you're on the call right now and I don't send you one, be sure to email me. I'm gonna make sure that I can get someone to help me make sure that I get all of the names, because we had over 120 at one time people on the call. So I want to make sure I get everybody's certificate of attendance to them. Let's see, we have another question. Is there a high turnover rate? If so, what is the main reason for nurses leaving? Well, as Ms. Owen referred to earlier, we have a saying in correctional nursing, and that is that you're either going to be with us for 3 months or 30 years. Because people figure out pretty quickly if they can thrive in this environment. And a lot of our nurses come to us through the travel agencies who had never really thought of working in corrections before. But when they start working in the facility, they say, I've found my last job. This is my forever home, and this is where I belong. And so they come to work for us as full-time state employees. But just like, I think that one of the best, there are some good experiences that can prepare you for this. I think someone that has experience in psych or drug or substance rehabilitation, or someone who works in long-term care, those would be good experience for this environment. And yeah, I mean, the people that work here love it, and they do find out pretty quickly whether they love it or not. And we do have turnover just like everywhere else, but it's those folks that decide that this is their forever home that stay for the long term.
All right, it's 1:05. We've had some really great questions this afternoon. I appreciate all of the questions and the interest in our system. We were very glad to share our world with you today, and I hope that some of you who were on the presentation today will come and join us for a tour and see our world in person. It's really quite surprising to those who have never been.
Indeed. Thanks again, everyone. So this is Ram signing off, and I will see you soon.
Thank you so much for joining.
Thank you.